Hello. It is by the grace of Almighty God that He has given us, all of us, if you are viewing me now, an opportunity to live again another day. We should always be grateful for every single day that we live. My name is Monica Buyo. My channel name is Monica Beyond Cancer. To our new subscribers, in this channel, I'm taking you through my personal experience, step by step, from the time of diagnosis with the multiple myeloma cancer and my journey towards healing through prayer and faith. I also wish to welcome new subscribers who are joining us. Kindly share my video with your friends, relatives, like, comment, and also click on the notification bell at the notification at the bottom of this video in order to receive my new vlogs every time I upload a new one. Currently, I'm only doing weekly vlogs, and as time goes by, we shall improve on that. To my old subscribers, thank you very much. Continue supporting me by watching my videos, commenting, and liking them. So just a quick recap from the last video. I was actually now being prepared to undergo surgery. The surgery came up. This was again a second surgery after a period of 6 months. So I was hospitalized on 30th January 2024. And now I was being prepared to go into surgery again, having had an accident at home, and again broke more bones. That is, those are issues that come up when you have multiple myeloma. So during the preparations, the hospital followed the procedures and their protocols to prepare me for surgery. I was informed that the surgery was going to take 1 hour. So prior to the surgery, actually, my discussions were between the anesthetist and the orthopedic surgeon, just taking me through the process. I was actually, after all those discussions, I was very relaxed and actually looking forward to the day of surgery. I was going to go through full anesthesia for my surgery. And full anesthesia surgery is not anything to take lightly. That is why the hospital had to check and counter check and go through all their protocols to make sure the surgery was going to be successful. So come the day of surgery, in my relaxed condition, I was wheeled into the theater. My family and I personally had appealed for prayers from my friends and extended family members and colleagues for prayer, and I'd even informed them the day of the surgery and there were people keeping a prayer vigil for me. And on that day, actually, the anesthetist had noticed that I'm a very prayerful person, very religious person. So when I was wheeled into the surgery room in the theater, the anesthetist asked me if I wanted to pray or if I wanted any of the team members to pray. I chose to make the prayer. I told them I would like to pray so that I may also pray for them because they work very hard. So I preferred to pray and pray for them too and pray for their families, the whole team that was in that theater. So I prayed. And once the prayer was over, the prayer session was over, the anesthetist engaged me in a discussion while they were putting through the medication, through the IV and all. So we were discussing my preference for a pillow. He asked me, how do I prefer my pillow? And I told him that personally, I would even sleep without a pillow. But since I need one, also because of age, I use a very thin pillow. And I told him that I actually miss the pillow that I use at home. Because the hospital ones, I felt like they were too thick for me. So he told me the pros and cons of using a very thin pillow and why at my age I should be using a slightly thicker pillow. So I said, okay, that's fine. But he asked me, so for today, which pillow size do you prefer? I still told him I prefer my thin pillow. And as the pillow discussion was going on, while I slept, I don't know what time I slept or what I told them about the pillow after that. Because I had already prepared myself. I was so relaxed. I was told the surgery was going to take 1 hour. So even as we were discussing that pillow talk, I was actually looking forward to very sound sleep. Because in the ward, because of my pain and discomfort, I wasn't really getting sufficient sleep. And with all the procedures that were going on to prepare me for the surgery. So I was actually looking forward to have very good sleep. So, but all of a sudden, like about 15 to 20 minutes, I had my name being called, Monica! And I sat up and I said, yes. And so I looked around and I saw all the surgeon and the people who were in the theater, all in their theater gowns and all. My next comment was, that was too fast. And I was told, yes, you're right. Because, I felt like I had not slept enough. So they told me, yes, that was fast. And we are going to take you to the recovery room. And your doctor is going to come and talk to you. We have done the surgery. It was successful. And your doctor is going to come and talk to you and tell you why it was so fast. So in the recovery room, I went and continued with my sleep again. I slept for a while. And when I woke up again. My family members were there. We prayed again. We talked. And I was happy to see them. And we were all everyone was in very high spirits. So later on, the doctor came and informed me that I was right about my surgery being so fast. Instead of 1 hour, it was 15 minutes or so. I'm not sure at the time, but maybe it took maybe 30 minutes or 20 minutes. I'm not sure, but it was not 1 hour. So the reason for that was that when the incision was made on my left femur, I bled profusely on that surgical bed. I bled profusely. So the doctor and his team, they had to work very fast, had to rush up very fast and fix my broken femur and insert the implant, and then stitch me up very, very fast to avoid further loss of blood, which was going to endanger my life. So when that was done, there was a screw that was meant to be fastened also on the implant. But there was no time to fasten that screw. So just to save my life, I was stitched up because it wasn't really going to be a major problem compared to me losing my life through serious loss of blood. And that is how the surgery went so fast. And so I was stitched up and went to the recovery room. And we still had further discussions with the doctor, with the surgeon, what would be the repercussion of me being left with a screw that had not been fastened. He told me that there were no serious repercussions, and he was going to give me further instructions about my sleep position and the do's and don'ts because of that screw that was not fastened. We thank God for giving us lives. We thank God every day because you can lose your life at just on the spur of a moment. You can lose your life. So after you've gone certain situations, you learn to really appreciate God. Every single minute you have, every moment you have, you appreciate God for giving you life. So that's what I have for you for this episode. Kindly remember to subscribe to my channel, share it, and let's continue the discussion through the comment section. Let me also hear your comments if you have ever gone through surgery under full anesthesia. Let me hear from you too. And for now, I'm going to leave you again with today I'm going to leave you with a short clip about me feeding my kitten, Leo. He had been unwell and I had to feed him. Until the next one, bye-bye. This is my kitten, Leo. He's 5 months old now, but he has been ill for the past 1.5 weeks. He got cat flu. So Leo was treated, was given appetizers, antibiotics, and some medication to control his temperature. I think that was done twice. Now he's well, but he does not want to feed himself. So every day, 2 times a day, I have to use a syringe to feed him. So sometimes I give him beef broth or fish broth, yogurt, or plain milk. I don't know if he's enjoying this, because every time I put some food on his plate, he doesn't. Or either he has lost his sense of smell. So I put food on his plate, but he does not eat it. Or he's just acting spoiled, I'm not sure. So now I have to feed him using a syringe. I got his nails trimmed so that he does not scratch me during feeding time. So Leo, here we go. Open your mouth, Leo. Just a bit. Good. Good, Leo. Good. Open your mouth. Come on, Leo. Here, feed. You have to feed. You have to eat. Come on, Leo. Open, Leo. Not happy? There. Good job, Leo. Good job. See yourself in the camera. Leo. Open. Hello, Leo. Good job. Good, Leo. Feeding time, Leo. So, yeah. Come on, let's feed, then you take your break. And we'll continue after 30 minutes, right? Yeah, Leo. Okay. So you're done, Leo? You're running away, you're full. Okay. Say bye to the camera. Look, Leo. Bye-bye. Bye, Leo. It's Leo. Leo? Say bye. You're not happy? Are you in a rush? Going somewhere? Bye, Leo. Bye.